So I think it's really an important issue that we should all be focusing on, because one of the things we really don't think about is postpartum. Because as doctors, as pregnant women who go through pregnancy, somehow delivery seems to be the end point of that journey. And I think all of us are equally culpable in making the postpartum period a not very significant period. But birth is a life-changing event in a woman's life. And post-delivery recovery is extremely important. And I think we need to start conversations around this very quickly, because world over it's accepted that the postpartum period in a woman's life is the most neglected period, and this can have really long-term impact on her physical and mental health, and it needs to be prioritized by families, by pregnant women who are going to deliver, by healthcare providers, by hospitals, by governments, and by health organizations like WHO. So I think it's very, very important that we start focusing on this period, because this is the period where I think the woman needs most help and she's left alone a lot.
Absolutely, ma'am. I definitely can relate to what you just said. Now, when it comes to postpartum, there are a lot of myths and a lot of facts. And especially, I'm talking about the traditional methods that have been practiced. So, I want to know that what are those traditional methods which are actually beneficial for a woman?
So, most traditional methods don't come with any harm. See, birth existed even before doctors. Women gave birth, have been giving birth now for centuries, and have recovered from that process. Traditional methods have evolved from experience, from observation, families who've seen women deliver and seen the problems they've gone through. And we must also remember that traditional methods were implemented at a time where actually surviving birth was considered a big achievement, because women were at very high risk of death while giving birth. So they took a lot of care of women who delivered, because I think they realized that surviving birth was a big thing that a woman could achieve, and they wanted to keep her safe in the postpartum period after she's gone through this grueling experience. So many things like isolation, dietary practices, they kept the woman secluded for 40 days usually, like what is thought to be quarantine. We still see that. It's called japa, it's called balinta in Telugu. These are all traditional things which have come through a lot of wisdom which comes from experience. And we should know how to integrate them into our own lifestyle now. But you also should remember that women at that time had very little pressures that contemporary women face right now in terms of return to work, in terms of career pressures. They didn't have that. So it was a time where they were looked after, isolated, their diet was taken care of. I very often hear, pregnant women or women who recently delivered come and tell me that we are asked to eat this Gondki laddu. We have something called balinta kayam in Telugu cultures. And these all come with a lot of science. These are ingredients which are there to ease digestive systems, to build immunity. And there's a lot of criticism of them now, because they say, these have a lot of calories, we put on weight. But you should interpret it in the context of the time where it was used. When women were fed these things, they never really ate anything else. So they were eating all this healthy thing in moderation. If you interpret in the context of Swiggy time, where you're going to eat these foods along with your pizzas or whatever you can order on the phone, obviously it's not going to work. So it has to be taken in a holistic way. Postpartum period was not an isolated thing. It was not this one practice of isolating the woman. It was not this one practice of giving her Gondki laddu. It was a lifestyle which was devised to protect women. They were isolated because they didn't want them to get infections. They were given a low salt diet because they didn't want them to develop postpartum hypertension. So we need to incorporate these good practices, and obviously we have to tie it into the pressures of the modern lifestyle that we are facing now. And I think it will work very well if these are put together. A lot of heat therapy was used, steam. I mean, all of us know that a lot of the smoke, steam, to heal perineum, to heal abdominal scars, all this was used previously, and it is now coming back, with evidence to say that it helps in the healing process, makes the pelvic floor stronger. So we should not dismiss these methods, and we should try to integrate them as best as possible into our lifestyles now. Most importantly, keeping that calming influence, focusing on that 40 days just exclusively on making the woman recover, which is very, very important.
Well, in short, just listen to your elders, right? That's the best we can do. And absolutely, they don't give us a choice, though.
Yeah.
That I have seen. They don't give you a choice. But as you rightly said, the practices which your, grandparents, as I may say, it really is beneficial for even this generation and the coming generation too. Another thing which I would want you to address, Doctor, is the anxiety and depression, which are just not the words. Every woman, postpartum anxiety and depression is the truth they live. So what can the society do, the people around, to make a woman become a little ease, get to an ease, or get through the anxiety and depression, if you can throw some light on it?
Yeah. See, again, like I said, pregnancy is a huge journey. And once you deliver, I personally feel this very strongly. When I cut the umbilical cord, when I deliver a woman and cut the umbilical cord, I think I'm cutting a lot of things. I'm not just separating the woman from the baby, the woman's body from the baby by cutting the umbilical cord. I'm separating the woman from many other things, including good care that should be given postpartum. Because I think we are so focused in this end point of delivery when somebody gets pregnant. We feel like we are running a race, and once they deliver, we can all just fall down and relax and pat ourselves on the backs and congratulate ourselves. And that's not the reality for the woman. When the baby is born, the entire focus shifts to the baby. There is this responsibility placed on the woman that her only role at this stage is to look after the baby. If she speaks about looking after herself, she's burdened by guilt. Now things are changing. I can definitely see that, because women are changing. They are able to speak up for themselves. There was a time when they weren't able to speak up for themselves, when they weren't able to talk about self-care, when they weren't able to talk about, recovering from this process of labor and delivery. So I think the most important thing that we can do to address women's mental health post-delivery, and it takes a beating, there is no two thoughts about it, because she's quite alone once she delivers. When we birth a baby, there is this newborn baby, but you're also creating this new mother. It may be her second birth, it may be her third birth, but for that birth, she's still a new mother, and we are forgetting that she has a lot of things going on in her life, and she needs support, and she loses it exactly at this time. If you look at her pregnancy period, she's surrounded by family who want to do everything for her, who want to make her well, who want this pregnancy to have a successful outcome, and they realize that she's central to that successful outcome. But once she delivers, that entire focus shifts and she's completely alone. She has to look after a new baby. She has to build a relationship with a new doctor, her baby's doctor, the pediatrician. And that's again a journey which is going to take a long time. And she has to look after her own recovery. And she's left quite unsupported. And I think the best thing that we can do is to have conversations around it. I think women should be educated right from the antenatal period. We speak a lot about, childbirth preparation, that's about labor and delivery, but we should talk to them about what can happen postpartum. I think they should be given enough information. We have a huge initiative towards postpartum mental health, and we make sure that, they're evaluated, and there's no subtle way of doing this. This has to be very direct. They have to be told that this can happen. Is it happening to you? Do you need help? We should not just, and doctors should be sensitized to making this happen. families should be sensitized to expect that this can happen, and it should not be viewed as, for want of a better word, nakra, or anything like that on the woman's part. She really needs help. And I think overall increasing awareness, ensuring that hospitals which take care of birthing process are also involved in postpartum recovery, giving them good help and improving society's awareness of this. And medical bodies like World Health Organization should make it the talking point and help women recover and become stronger.
Yeah, I think what you're talking about is absolutely very relatable. Few of them are blessed that the people around are empathetic towards the new mothers, and few are not, as you say, nakras. So to each its own, the depression and anxiety. But one last question I want to end this fire chat with you, Doctor. You have, put light on many important points. But one thing I would want to ask is, what advice would you give the new mothers struggling with their physical and mental health? Well, you have said what the society should do and what the people around or the doctors should do. But what about the new mothers? So this is the last question from my side.
So we are in a changing society. The fabric of society is changing. The fabric of family has already changed. We know that we've moved on from joint family system to nuclear family system. And change is a constant in all lives, and we have to accept it and move along with it. There's no point in saying that was better, oh, I wish we had the joint family system. It's not going to happen. We are always progressing, moving forward, and we have to take the good of that and make sure that the bad of it is corrected. And for women, my only single advice is that you are your best advocates. You have to learn to speak up. You have to learn to prioritize your health. And this is something that I think when we bring up girl children, I think we have to teach them to learn to prioritize their health. Because that is the last thing. If you see, the only phase in a woman's life where she receives committed care is pregnancy. Because the entire family is tied into her well-being at that stage. But at every other stage in her life, she's constantly putting her health on a back burner and prioritizing the health of her husband, her children, her in-laws. So that is something, she needs to get out of that mode, because there's a lot of guilt associated with it. And for new mothers, I think it's even more, because I think the entire family also feels that they should be more focused on looking after the child and not looking after themselves. So they need to speak up for themselves. They need to learn a lot about what it is to recover postpartum. Ask those questions of your doctors. Don't think pregnancy ends with delivery. You have to live a whole life after delivery. And get that information, use it, assert the need for you to do that. Focus on your physical health, your nutrition, accept the fact that your mental health can take a beating, and you need to seek help when that happens. You need to have that awareness. So I think the most important thing for the woman is to spell out her needs. It is challenging, it's an uphill task, not that people are going to accept it, but she has to repetitively spell out her needs and educate herself about, what it is to recover.
Good evening, everybody. It's lovely to be here. And I think I came in at the absolutely right time to a very insightful conversation, a fireside chat with Dr. Reddy. It was so lovely. I have to say, before I start with whatever else, I have to say, Doctor, I wish 19 years ago, because my son is 19 years old now, I wish I had doctors who were aware of this. Time changes, but I couldn't agree with you more in what you were saying and how this needs to be a part of the conversation. And this was something that we all, as we went on, I wrote a book on it, and we were all talking about the guilt that we as new mothers face, and the challenges of it not being a joint family. So we want the good from the joint family, and we want to move on with the nuclear family setup also. So we have to combine the two. It was so well said. Thank you so much for that.